Now we'll look at vitamin D and COVID-19, starting with the vitamin D and other viruses also. Vitamin D and COVID-19. Vitamin D and its relationship is in fact with COVID-19 infection, severity and mortality has been well studied. And vitamin D has gained significant attention during the COVID-19 pandemic due to its role in immune function and inflammation regulation. Research suggests that vitamin D deficiency possibly increases susceptibility to infection. It can worsen disease severity and elevate death risk in COVID-19. Now, look at this slide. It shows how vitamin D levels in the body is seasonal. You'll find during summer, vitamin D levels go up, and during the cold seasons, it becomes low. This slide shows the seasonal variations of 4 types of coronavirus. COVID is the 7th coronavirus. There were 6 other coronavirus before COVID came. So we know basically or certain things about, we knew already about COVID. And here you have the slide showing 4 types of coronaviruses, that is HKU1, OC43, 2993, and NL63 over 3 years, many years ago, and the seasonal variation seen with influenza A and B. You'll find all these infections were more during the cold season. And the large peaks that you see, the single large peak, are of influenza. And like the coronavirus, tend to occur during the cold season when vitamin D levels are low. There is an association between vitamin D pre-infection levels and severity of COVID. A significant difference in vitamin D was found between mild compared to moderate disease of COVID and between moderate disease compared to severe COVID disease. Lower vitamin D levels were associated with greater disease severity and mortality or death. Pre-infection and vitamin D deficiency increase the risk of COVID-19 at any age. Now we see the association of vitamin D levels with age and severity. Older age was associated with both vitamin D deficiency and poorer COVID outcomes. Reduced vitamin D levels in younger patients admitted with COVID-19 suggests an increased risk of hospitalization, while older patients remain at increased risk of hospitalization, even with higher levels of vitamin D deficiency. So older people were more susceptible to severe infection or hospitalization, even though their vitamin D levels are not as low as in younger people. And here's one of the first slides that we got. During the earlier parts of COVID-19. Actually, this came from Indonesia, and it wasn't a perfect study, but look at the way that people have thought. And in Indonesia, it's probably, I would say, it's a quasi-perfect study where they found that mortality at around 60 years of age had something to do with vitamin D levels. And this is one of the things that even startled the Germans, and they took it very seriously, and they went, I think they spoke to the chancellor, and they wanted everybody in Germany to take vitamin D as a prophylactic protection for vitamin or COVID. Role of vitamin D in the immune system. Vitamin D plays a crucial role in both innate and adaptive immunity, we said, which are essential for fighting viral infections like COVID-19. Innate immunity or first line of defense um, uh, depends on the is consists of enhances the production of antimicrobial peptides, which help neutralize viruses, boosts macrophage and dendritic cell function, essential for immune responses, and reduces excessive inflammation by regulating cytokine release. And what is the adaptive immunity or long-term protection that it gives? Vitamin D gives. It modulates T cell responses, helping the body recognize and fight SARS-CoV-3 more effectively or COVID-19 more effectively. Reduces cytokine storms. We all know about cytokine storms, a major cause of severe COVID-19 complications. Vitamin D and COVID-19 infection. Risks. Several studies have found that individuals with low vitamin D levels are more likely to contract COVID-19. This is considered so as vitamin D helps maintain the integrity of respiratory barriers, reducing the entry of viruses. Some research suggests that vitamin D upregulates ACE2 receptors, which may influence viral entry and immune response. Okay. Vitamin D and COVID-19 severe deficiency is linked to more severe disease outcomes like pneumonia, ICU admission, and mechanical ventilation. Meta-analysis found that patients with vitamin D deficiency were significantly more likely to develop severe COVID-19 compared to those with sufficient levels. Vitamin D reduces pro-inflammatory cytokines like IL-6 and TNF-alpha, which drives severe lung inflammation and damage. It also prevents blood clot formation or thrombosis, a major cause of complication in COVID-19 patients. Vitamin D and COVID-19 mortality. Studies suggest that hospitalized patients with severe vitamin D deficiency had a higher risk of death due to respiratory failure and organ damage. Vitamin D may help reduce lung injury and ARDS or acute respiratory distress syndrome, which are leading causes of death in COVID-19. Can vitamin D supplementation help? Some studies definitely indicate that vitamin D supplementation can reduce the risk of severe COVID and improve recovery. Dose of 2,000 to 4,000 per day of international units may be beneficial for immune function. A COVID trial found that high-dose vitamin supplementation reduced ICU admission rates in COVID patients. Who should consider supplementation? Older patients, as he said earlier, older patients are often higher risk of vitamin D deficiency due to reduced sun exposure, reduced kidney function, limited sun exposure, chronic conditions, like obesity, diabetes, kidney disease, and they can have lower vitamin D levels. Since not all, but many of our audience is in India or from India, let's check out. Let's check it out. In India, we have plenty of sunlight, but vitamin D deficiency is highly prevalent. The studies estimating that 70 to 90% of the population has insufficient levels of vitamin D. The deficiency is widespread across different age groups, including children, age, and elderly. So what are the causes or what are the reasons for high vitamin D deficiency in India? One, limited sun exposure. It's not limited sun availability, but it's limited sun exposure. Despite abundant sunlight, many Indians avoid direct sun exposure due to cultural preferences for fair skin, fear of tanning, and lifestyle changes. Urbanization has led to more indoor living and less immune outdoors. Air pollution. High pollution in cities block UVB rays, reducing vitamin D synthesis in the skin. Deficiency, dietary deficiency. Indian diets are low in natural vitamin D sources like fatty fish, eggs, fortified dairy products. Vegetarianism is common, and plant-based diet lacks vitamin D. Skin melanin content. Darker skin contents have higher melanin, which reduces the skin's ability to synthesize vitamin D from sunlight. Clothing practices. Traditional clothing such as saris, burqas, and long-sleeved attire limits skin exposure to the skin. A lack of fortification. Unlike some Western countries, India does not have widespread mandatory food fortification with vitamin D. Medical conditions and lifestyle. Increased prevalence of obesity, diabetes, metabolic disorders affect vitamin D metabolism. And of course, there is a lack of awareness and there's lack of routine screening leading to underdiagnosis of vitamin D deficiency. So, while vitamin D does not absolutely prevent COVID, studies have shown that infection risk, severity, and mortality are inversely proportional to vitamin D levels, meaning as the vitamin D levels go down, the infection rate goes up, the severity of COVID goes up, and death due to COVID goes up. Vitamin D shows protective action against not only viruses, but also against bacteria and fungi. We have already seen that it's important for various normal functioning of our body. So it would be prudent to make sure that we have adequate vitamin D levels in our body, whatever be our age. And generally speaking, supplementation with vitamin D is especially recommended for individuals at risk of deficiency, especially older people, those with limited sun exposure, and people with chronic health conditions. And so thank you so much for your patient